Well, what's very interesting is being an entrepreneur was never really in the cards for me. I mean, that was nothing I envisioned myself doing initially. But, there's a statistic that about 50% of clinicians, leave their first job within a couple of years of leaving because, we're still learning the nuts and bolts. And so I did what most physicians, do after, a year of working at their first job. And I decided to, leave. I was going to look for other employment opportunities. And then what ended up happening is all of my pregnant patients. So I'm a family medicine doctor. So I'm like, you know, years ago, I was traditional family medicine. I mean, delivering babies in the hospital, doing circumcisions, all of that sort of stuff. But I was put in a position where I was going to have these patients that I had to care for, and I didn't have a place to take care of them at. I knew when they went to the hospital, they were going to call me for them. And so it sort of sent my husband and I, who has his uh, bachelor's from Rutgers in business, it kind of sent us into sort of this crossroads where it's like, okay, we either roll the dice with these patients or we just jump out there and, you know, develop our own clinic and do it our way. And, by that time I'd actually was wrapping up a health policy fellowship, which was, one of the biggest things for me that catapulted me into becoming an entrepreneur because I saw all of these problems and pain points. And I was like, well, how can I use my experience as a doctor and then also having a business arm with me that, doesn't have any benefit to just make a lot of money. He's here to support me. How do we kind of create the perfect sort of, clinic for patients? And so in the area I was practicing in at the time, it's called New Braunfels, Texas. It's a little old German town, halfway between Austin and San Antonio. We created a clinic, and I started off lean. I started off small. I actually was in a place called My Salon Suites because it met all of the ADA requirements, for having accessibility and all of that sort of stuff. And it had a ring-in system, and a lot of the beauticians and lash artists and things like that were my patients. They sent patients to me, and it was a really good experience. But I was able to start slow and make a lot of the small mistakes without having too many things at stake, if that makes sense.